Monday, October 19th, we welcome you to the first daily briefing for this week. These come to you weekdays in the 1, 5, and 8 p.m. hours on the radio and are uploaded as soon as we can get them there to youtube.com/Cordova TV. Don't have a guest today, at least not in voice, but we have content from a number of sources we're going to share with you as we plow forward into the new week. And we get to start out with some positive news as far as our local uptick in cases goes. A number of the folks who were ill at the leading edge of it's an outbreak. Technically, it's an outbreak. A number of those are better, with no new additional cases being reported as of the last dashboard update. So we were at 13 or 14 on Friday, I think it was. Now we're down to 8 active cases. All of them residents, and the non-resident totals back to 0. So that's certainly a plus that we're not continuing to add to this total, while on the other side of it, these people apparently are getting better. Or have gotten better, and still no hospitalizations or deaths for Cordovans, which are, the grimmest of the statistics. So we're thankfully continuing to avoid that problem. Now, the guidance from the city remains the same on this, saying all residents and visitors are reminded to do their part to stop the spread. The city has a mandatory mask rule when in public, social distance by staying 6 feet apart, and avoid indoor gatherings. I would say I would say editorially that's probably the most important part, because that, as we'll see in the state report, has continued to be Alaska's problem. The primary reason that cases have been going up so steadily is people not from the same household having indoor gatherings and kind of relaxing their guard. The city goes on to say the safety precautions have been in place for many months, and the Cordova medical team understands it can be inconvenient and frustrating and wearing on individuals. Some have let their guard down and invited friends over, forgot their mask at home, or been in contact with someone who tested positive. If so, individuals are encouraged to get tested to prevent further transmission and work with the medical team for contact tracing. Everyone is asked to recommit to the community's overall health and follow the safety recommendations that we're all familiar with masks, distancing, hand washing, and not interacting with people not of your own household if possible. Or if you have to, then again, make sure you're masked and don't get closer than 6 feet. Alanka is testing Mondays and Fridays from 2 to 3 and Saturdays from noon to 1. Cordova Community Medical Center is testing Wednesday and Thursday mornings from 9 to 9:30, and then covid19.cityofcordova.net is available if you would like to get more information from the city. Now, turning to some state news, which again, we present to you here with the hope that it can help us prevent any mistakes that are being made at the state level, which if we make those same mistakes, obviously we can have the same results with an uptick in cases. And unfortunately that, to an extent became a prophetic concern because we ended up, we had people doing some of the same things that people were doing elsewhere in the state, and we had the same results, mainly getting together with people that they don't live with. So it does help to, if we want to keep our case count as low as possible, it does help to look at what's going on around Alaska. First off, they had more cases reported in Alaskans the previous week than any other previous week by about 40%. What was it? About 891 new cases. The sharp acceleration affected urban and rural regions. The largest increases in case rates were in the Yukon-Kuskokwim Delta region, Anchorage Municipality, and Fairbanks North Star Borough. The Northwest region continues to have the highest 2-week average case rate of any region in the state, and it saw increases this week. The daily state case rate as of October 10th is 21.4. up from 16.3 on October 3rd. That's a 31% increase. That number is cases per 100,000 people averaged over 14 days, so the state alert level remains high. Compared to other states' case rates, Alaska's average case rate per capita over the last 7 days covered in this report remains at 13th highest in the United States, just below Wyoming and worse off than Missouri by a little. If Anchorage were its own state, its 7-day case rate would rank it at number 6 worst in the nation. Fairbanks' rate would put it at number 5. The Bethel census area, if that was a state, would be number 4 in the nation. So that's worthy of note because travel to, let's say Anchorage particularly, being the most Anchorage or Fairbanks, traveling there essentially makes the risk of bringing it home with you the same as going to a lot of places in the lower 48. So while travel is not banned or restricted, and obviously there's some reasons, medical reasons or whatever that, people need to travel, it just emphasizes the importance of being careful while you're out of town and then being careful when you return. Unfortunately, an updated model epidemic curve predicts Alaska's cases will continue to accelerate over the next week. 2 weeks ago, cases were expected to double every 105 days. Now that's more like 20, double every 20 days. Non-resident cases continue to not really be a factor, just in single digits each day. So again, what's happening in Alaska is us doing it to ourselves. That's the case statewide and recently what's been going on here. Fortunately, Alaska continues to have the fewest COVID-19 related deaths per capita of any U.S. state, although we have now had more deaths than both Vermont and Wyoming. Now, on the positive side, even though obviously this is not a competition, between states, there was a study in a news release that came out this morning, actually. A recent study by Evergreen Economics comparing COVID-19 cases, hospitalizations, and deaths between 7 geographically large and predominantly rural states, of which Alaska is one, found that Alaska has fared better so far than our peer states. And then there's a bunch of numbers, and it says the data illustrate the power of prevention, highlighting the efforts of everyday Alaskans as well as the public health and healthcare response. Governor Dunleavy said, quote, "The report illustrates the outcome of the selfless efforts that were made to protect public health by all Alaskans. While the pandemic is not yet behind us, we have a strong sense of optimism looking forward and will continue to monitor and respond to this evolving situation with the health and well-being of Alaskans at the forefront of our decision-making," end quote. DHSS Commissioner Adam Crum said, quote, "Prevention efforts have made a big difference in Alaska. This report highlights our successes, but also underscores the need for all of us to remain vigilant. How we continue to respond over the next several weeks to months will determine how well we ultimately fare in this pandemic. Our goal is to keep Alaska's hospitalization and mortality rates as low as possible, but we need everyone's help and renewed commitment from Alaskans to ensure that happens," end quote. And Dr. Zink, Alaska's chief medical officer, said, quote, "Prevention works and saves lives. With most regions in Alaska now at high alert level or red zone for the 14-day daily case average, we all must step up our prevention efforts. Let's protect vulnerable groups and continue to keep our hospitalizations and deaths low," end quote. And this state report concludes by emphasizing what, of course, are very familiar prevention methods. Keep close interactions to a very small group of people, ideally just within your household. Again, this is where Alaska is getting burned and where it sounds like we had trouble with these over 24 cases lately. Ideally gathering just within your household or just with a very small group of people. That's top of the list. Keep 6 feet away from others. Mask up in public places. Avoid gatherings. Find creative ways to be social that keep people 6 feet apart. Being outdoors around others is safer than being indoors. Wash hands often. Clean and disinfect commonly touched surfaces and objects. Stay home if you feel sick. Get tested for COVID-19, even if you have one symptom or mild symptoms. Keep track of your contacts and contact them immediately if you should test positive. That can be real important for keeping a localized spread from breaking out into the larger community, which thankfully, again, it would, despite our numbers jumping up in Cordova here recently, we do seem to have avoided a larger spread that was not contained within the group or groups where it started. So that is, the people responded in terms of the people involved, the people who had it, isolating themselves, the contact tracers. There are a lot of things that worked very well once the cases were identified. So that's why keeping track of anybody that you come in close contact with is very helpful. And then finally they say answer the call if a public health contact tracer calls you, and follow their guidelines. So that's what we have to start out the week for you. And of course, if anything should come up between now and the end of the day, we'll update the report and get that on the radio and to the YouTube channel. COVID-19.cityofcordova.net if you want to be able to connect with the latest information from the city. Again, some good news with no new cases reported and a number of our existing ones getting better. If you missed that earlier in the show, we had, I think, 13 active cases going into the weekend. Now we have 8. So that is an improvement. But we need to stay vigilant, obviously. If you have any questions, the 424 info line is available at the city. 424-WELL has pre-recorded information from the Village of Eac. And we'll continue to do our best for you in the 1, 5, and 8 p.m. hours on the radio and online at youtube.com/Cordova TV. I'm J.R. Lewis. Thanks for listening. On this Monday, the 19th of October, we'll get you back to regular programming.